Okay, welcome to today's webinar. Today the webinar is entitled Illinois InfoNet Gathering State Victim Services Data. My name is Bailey Merrifield and I'm a research analyst with the Center for Victim Research. The center is a partnership between researchers and practitioners. We work with between the Justice Research and Statistics Association, the National Center for Victims of Crime, and the Urban Institute. We are funded by the Office for Victims of Crime, so we definitely want to acknowledge their support of this project. We are a one-stop resource for victim service providers and researchers to connect and share knowledge. We have all sorts of resources on our website. You may be familiar with CVR through our funding of partnerships between VOCA administrators and state statistical analysis centers, or our research webinars or podcasts. Many of you have registered for our library, which is a subscription for research journals free to SACs and any agency receiving VOCA funds. So we definitely want to make sure that you get access to this library. If you have any questions about the library, please send a chat in the chat box or feel free to contact me after the webinar. Speaking of the chat box, we definitely want to make liberal use of that throughout the webinar. Please enter questions as they come up. We will have several pauses for questions throughout the webinar. So with that, I would like to welcome our presenters, Jacqueline and Jennifer, and I am now going to hand over control to you and let you introduce yourselves.
Great. Thanks so much, Bailey. Can you hear us okay?
Yes, you sound great.
Great. So my name is Jacqueline Houston-Kolnick. I manage the Center for Victim Studies, and I'm here with Jennifer Heiselman, who's the InfoNet manager. And InfoNet sits within the Center for Victim Studies. What we are is that the Center for Victim Studies was formed about 3 years ago. With the increase of VOCA funds that we received, it was a massive influx. I'm sure that many of you also experienced, from around 17 million to 80 million. And as our agency stepped back and thought, what's the best way for us to spend these funds, we made the internal decision to build our capacity not only in grant monitoring, but also in our research unit, because we are both the Statistical Analysis Center and the SAA for the state of Illinois. And so we decided to build out the Center for Victim Studies to do research in order to help inform policy practice as well as our grant making and funding. So later on, we'll just briefly mention the first project we did was victim service planning that was using some InfoNet data as well as some other means to help create our strategic priorities for how we are spending our victim service funding over the next 3 years. So that's a little bit about who we are. We are able to build ourselves out using admin funds from both VOCA and VAWA. And now we continue to kind of grow our portfolio through exciting opportunities, one of which you'll hear later today. But InfoNet's something we're really proud of. And with that, I'll hand it over to Jen, who's really been a pioneer in building what InfoNet is in the state of Illinois.
Thank you, Jacqueline. Good afternoon, everybody, or morning, depending on where you are. I'll talk a little bit today about InfoNet's history, including how and why it began. I will demonstrate some of InfoNet's primary data entry and reporting components, talk a little bit about our InfoNet Rewrite project, which we recently wrapped up and gave birth to InfoNet 2.0, and then finally our current endeavor, which we call InfoNet Stepping Forward, aims to expand InfoNet in terms of depth by building more functionality and new data elements, as well as breadth by building a whole new interface to try and add police and prosecutor-based victim service providers into the InfoNet user group, because it's currently only available for 3 types of service providers, which include domestic violence, sexual assault, and child advocacy centers. Okay, so what is InfoNet? It's a web-based system, and it is supported by staff here at the Criminal Justice Information Authority. As Jacqueline said, we're fortunate in that we are a SAC and an SAA housed in one organization, which has a lot of benefits. And InfoNet's use and requirements are collaboratively governed by staff here at the authority, as well as its funder partners, which I'll describe in more detail shortly. And while the system has primarily been used as a data collection and reporting system for meeting funder requirements and strategic planning, probably a little more so than a case management system, our current InfoNet Stepping Forward project aims to really strengthen InfoNet in this capacity by adding new functions that will enable providers to better assist clients with developing their service plans and helping them meet individual goals. Okay, so InfoNet's been around a long time. Planning began in the mid to late 90s with these purposes. First and foremost, we wanted to standardize the victim service data. As you know, the ability to make anything meaningful with any kind of data is challenging, to say the least, if the data are not standardized. Establishing a central data repository, not only does that enable funders like the authority and our partners to easily extract grantee and statewide or regional data easily, but it also shifts a lot of those technological burdens that local service providers often don't have a lot of research or resources for. It shifts those burdens more towards a state agency like the authority that's better equipped to support those functions. We also wanted to ease reporting burdens for funders. As you know, they have many different funders requiring vastly different types of data. And we find, and I want to emphasize the provider aspect on this point because it's one of the, I think, most important keys to successfully implementing a system like InfoNet is it has to be useful not just for reporting for grants, but also to local providers for their internal decision making. If it's not made with those goals in mind, not only are you going to end up with poor quality data, but a lot of resources are going to be wasted on both the funder and provider ends. I always try to imagine our utopia for InfoNet would be that most local providers are mandated to use InfoNet by their funder, but we strive to make this system so useful that providers would voluntarily use it, even if they had no funders to report to, because they would see it as an investment of their time, and they would consider it a way they can maximize their resources. Another key component to establishing InfoNet was our partnerships. During this time in the late 90s, some of you that have been around a long time may remember it was similar to today in that there was a quadruple fund increase in VOCA dollars in 1997. So that was going on. VAWA was relatively new at that time. So we thought that it was, in building a data collection system, the best place to start, it made sense to partner with our two state coalitions, the Illinois Coalition Against Domestic Violence, we call ICJIA, and the Illinois Coalition Against Sexual Assault, or ICASA. Those are our two original partners. Those two organizations are also our lead entity for VOCA and VAWA domestic violence and sexual assault funds. So they subgrant to their member providers. And when we first were thinking about InfoNet, we envisioned actually a much simpler version than what we have today. And it's really when we brought the coalitions to the table, they had a lot of other ideas for how they wanted to use such a system. And maybe this is the case in every state, but in Illinois, our coalition's boards are made up of the directors of these service providers. So when you partner with the coalitions, you are also partnering with the local provider community. And they brought a lot of ideas into how InfoNet should be designed that they would find useful, which was critically important. These advisory groups also had to work through things like system requirements, what kind of computers will they need, what kind of internet connections, and back at this time, high-speed internet connections were few and far between, particularly in our rural areas. So that required some conversation in and of itself. Standardization and definitions. What are we going to call a client? How are we going to define these services, and what terms will we use? Data ownership, access, and use. Who's going to own this data? Who's going to be able to access it, and how will others be able to use it? Client confidentiality was probably their top priority, and then roles and responsibilities. Who's going to do what? So one of the products born out of these conversations were user agreements. They're called InfoNet user agreements. Every local provider that uses InfoNet has one of these, and it lays out that they have exclusive ownership rights over their data. In addition, regarding who can access data and what can they access, funders only have access to aggregate or summary data only in InfoNet, and they use these data for obviously grant monitoring as well as strategic planning. Funders can share these data with other parties so long as that data combine multiple providers. An example of that is Jacqueline and I are now working on a request we recently had from the Chicago Tribune. They want to know how many domestic violence victims were served by those programs in Chicago. We are able to provide that number because it's an aggregate number and it combines multiple providers. If more detailed data are needed for research planning purposes, we can do that, but we first need to obtain provider approval. And honestly, I mean, this does require more work, resources, more time, but we think it is well worth all that because it really works to develop sincere user buy-in and ensures that when more detailed data are used, that for any purpose, that purpose is, one that not only benefits funders, but also providers and the people they serve and the state of Illinois as a whole. So we think this is a way that makes, getting provider approval, it also ensures that data confidentiality and security protections are upheld. And we think this truly institutionalizes those processes, promoting strong, healthy partnerships, and also reflects our values that providers and the people they serve really should have a strong voice. Okay, so this slide should probably say newer partners. Department of Human Services for the state of Illinois, they were our first paying customer. We formally established a contract with them in 2003. And a side note, we do not charge either of the coalitions to use InfoNet because they are our lead entities and and administer funds that pass through our organization. So charging them would be like charging ourselves. But the Illinois Department of Human Services, they administer nearly $30 million in funding to domestic violence and sexual assault programs annually with state funds as well as FVPSA. So over the past decade, they have supported about 20% of InfoNet's operating costs, and in return, it helps them glean important data for the nearly, like I said, $30 million they administer annually. Also in 2003, we worked with directors of CACs to build an interface for them. We have 9 CACs using it now. They are a little more decentralized than the other types of service providers, so each CAC has the option of whether they want to use InfoNet or not. And we currently have a pending agreement with the City of Chicago, so we very soon expect them to be our second paying customer. They administer funding to about 20 domestic violence programs in Chicago and have already revised their data reports to reflect the categories displayed in InfoNet reports. And then another, a couple other state agencies we have in mind now that InfoNet 2.0 has rolled out is the State Attorney General's Office, who administers a fund very similar to federal VOCA, but it's Illinois' VOCA that we call Violent Crime Victim Assistance Act funds, as well as the state's Child Welfare Agency, which is the Illinois Department of Children and Family Services. And I can't underestimate the value of gaining partners like this, especially those that are going to help support operational costs of such a system. Not only does this improve the system's usefulness, but it eases burden on providers when more funders are talking to each other and becoming more consistent about their requirements. And it also will certainly improve the system's sustainability. So this is simply how many local users we have now using InfoNet, and then 5 funders. We shortly expect that to increase to 6 once our agreement from the City of Chicago is finalized. And data security, again, a top priority of our users. They want to make sure their client data is protected and secure. So how do we do this? We have a very strict security system in place that protects InfoNet. We actually purchase our own VPN, or virtual private network, so that we have more direct control over the protection of InfoNet data and can enforce those security policies. And a virtual private network by nature encrypts the data as they are transported from our local providers to our servers here at the authority. It also authenticates individual users as they log in. And a third protection measure that's unique to InfoNet is that our VPN also authenticates the actual devices that users log in from. So only approved devices that are owned by the service providers are authorized to access InfoNet, and this ensures the directors of these local service providers that the staff who they grant access to InfoNet, they can only access InfoNet from their work computers. They cannot access from home or any other public location. So that's an extra security measure that, again, it requires more work and resources, but protecting the data is top priority. The web application, InfoNet itself, has another layer of password protection that only service provider directors are privy to, and then they share those credentials with the staff they want to give access. Again, funders do not have any access to record level data. That's only accessible to center staff. And this was a conversation that the advisory group spent a considerable amount of time on, but they agreed to not share data across centers. I mean, first of all, it's illegal. You couldn't do that anyway without the survivors signing a release form. But this means that there is some duplication of InfoNet clients if you were to run a statewide report. While the client counts are unduplicated at the organizational level, there could be some duplication when you run reports that combine organizations if a client went to multiple organizations for services. Client confidentiality. No identifying information is entered into InfoNet. There's no names. We don't even enter date of birth. We enter age at first contact. And each client has a unique alphanumeric number that is assigned by the center. And they can come up with their own numbering system, but the one rule they have to follow is that alphanumeric number cannot contain anything that could potentially link them to the client. So it can't be initials or birth date or anything that potentially links them. And then if there are any pieces of information that the center staff feel could threaten or jeopardize a client's identity, particularly in rural areas, providers are instructed not to enter that data. Okay, so we'd like to retreat to this peaceful-looking island. This is what we in Chicago often think about this time of year, and it's been a particularly long winter, so I wanted to take a pause and break to see if anybody had questions so far.
So we have had one question entered into the chat. It's related to PMT, so it's asking how InfoNet data are utilized for the PMT and integrated with states' electronic grant management systems.
We will get into PMT a little bit later, but there is no integration with the state's grant management systems. They are separate systems. So the grant monitors at the authority have one system where they can look up who their grantee is, address, contact information, you know, the amount of funds and what the requirements that are met, but the program data, the programmatic piece is what InfoNet contains. So there's no link there.
And this is Jacqueline. We have kind of intentionally separated those systems as part of when we were working with our service providers, was that we in the research unit are separate from the grants unit, and that way any request for data would still have to be formalized and done between the center who has the grant and their funder. The coalitions have a funder's access that Jen will show you later, but here, at least as the SAA as well as the SAC, we separate out that access because we don't have free access to the information other than Jen's technical assistance, or the Jen and Carl, who also works on InfoNet, their technical assistance they provide.
Okay. I think we'll move on unless anybody has other questions so far. So that was pretty much all the groundwork that had to take place in order for InfoNet to be born, so to speak. So now I'll get into what kind of information is in InfoNet. This is just a picture of how many records we have. Being 21 years old, we've accumulated quite a lot of records. And I want to stress 2 points as to what I believe why we are standing strong today still is, number one, this is not a system designed by a funder. It's not a system that's designed by a private company for a profit incentive. It was literally built from the ground up by funders and providers together with the sole motivations of what do funders need and what do providers need to do their jobs better. And that's it. And if you keep those core goals in mind, I think your likelihood of implementing a similar system in your state will be much higher. Second, it's that perpetual routine communication among providers, and by providers, I mean staff of all levels. I mean, there's somebody entering data that's going to have suggestions, directors have suggestions, those that provide the direct services have great suggestions, and we include all these kinds of people in forums we call user groups that tell us, how InfoNet's working well, what's not working so well, and that informs what updates and how we can modify InfoNet to meet evolving needs. Okay, so I am going to share my screen, and we're going to actually go into the live system. Oh, here we go. Oh, yeah. Okay. So this is, I've already logged into the VPN in the interest of time. So this is what providers see once they get through the VPN account. I'm going to log in as a domestic violence training center. So you will be seeing the domestic violence interface.
And all of this is dummy data, so none of it is client data that is live and active, but this is a site that we use for training when we're helping providers understand how to best use InfoNet.
Yep. Okay, so if I'm a provider and I want to bring up a client, I can either type it in this field here, I can even type in a partial, it'll give me all the client IDs that meet that criteria, or I can just click client and then search cases. I am just going to view, it displays all clients that are recent. If you wanted to search for earlier clients, you could change search criteria here. I'm going to go ahead and click on this client for our viewing. So when I click that brings me to this client's intake page. But, this client doesn't have very much data entered. That's why this is a training site. But you can see we collect basic demographics. The first contact date is entered. It's pretty, I think it's very user-friendly. You can see all the fields are either drop-down menus, numeric, dates, or checkboxes. Each section has sections you can expand or collapse if you want to scroll through a little more quickly. The presenting issues reflects the type of victimization this client is seeking services for. We're in the DV interface, so we only have 3 primary presenting issues to choose from. And you know, we all know domestic violence victims often experience multiple forms of violence, so they select one as the primary, but they can also select other presenting issues. The offense or the incident that prompted them to seek services, they enter where that offense occurred, as well as about when it happened. Here we have income and income sources, monthly amounts. If the client receives any public benefits, they can indicate that here, or if they receive none. What type of health insurance they have, referral sources, and they can even select the specific agency that referred that client to the provider. And this drop-down menu is one of the few in InfoNet that the local providers can define themselves. So a Chicago's field here is going to look a lot different than a city or a provider in Southern Illinois. Who my client is being referred to. If they have any special needs, I can indicate that here. Here's limited English proficiency. When I check that, I can select the client's primary language. And I can start typing to make data entry a little faster, although my keyboard is not very good. My keys keep sticking. Here is where providers indicate what services clients may need, and they can update it when the services have been received. Residents, they can enter where the client lives down to the zip code level. And if the client moves or changes residence while they're engaged in service, the provider can add more residence record as that happens. Previous service use, that's mostly for HUD, helping them get closer to an unduplicated count of the homeless population. And with InfoNet 2.0, it really allows for faster, easier navigation. It's got a cleaner, more modern look than the old system. And we built more validations into InfoNet to stop data entry errors at the door. So that helped improve the quality. We're going to enter a service or two for this client now. Oh, and it's warning me that I haven't saved anything. So I'm going to first save the changes I made. Okay. And then, so if we want to add services to this client, I can click on the services menu item. These are services this client has received recently. To add another one, I can just click my service drop-down menu. I can select the staff that provided that, the date, and then hours is always rounded to the nearest quarter hour, so every 15 minutes is 0.25. Save my service, and that's how each service contact is collected. There is a separate section for housing services, emergency shelter, and transitional housing, where you can select off-site shelter, which is like a voucher to a hotel, emergency, and then transitional housing. Those who are in shelter, providers can enter departure information indicating where they left, when they left, to what type of housing and why. If somebody doesn't show up to a counseling appointment or cancels, you can enter that information, services received. And InfoNet wasn't just designed for services to clients. Providers also enter services they provide to the community. So if I want to enter, let's say, some of my prevention work, or perhaps I've done some training, I can enter that information here. I'm going to go back to our client, and I'm going to show you now how we can also enter client interactions with healthcare and legal systems. Now, what I've shown you up to this point are most of the funder mandated fields. What I'm getting into now are those fields that are no funders require, but when we brought providers to the table, these are the kind of things they wanted InfoNet to include. It helps them do case management, and it also helps them advocate for systems change with community partners. You can talk to hospital managers or police chiefs or prosecutors, for a long time, but you're going to have a lot more leverage in affecting and influencing policy change when you have the data to back up what you're saying. So this is the incentive for providers to use these sections of InfoNet, even though they're not mandated. If a client has visited a medical facility, they can enter that information. Here are some items from the conflict scale that can be checked to show what types of violence this client experienced. This section, you can enter if the victim reported to police, you can enter that date. If they are going to court, you can enter all their court appearances and whether or not there was actual case progression during that appearance, or if it was a continuance on either the defense or prosecution side. And then here is orders of protection. I'll open that up so you can see a little more details there. Providers enter when they filed, when it was issued, the expiration date, and if that order is later upgraded or there is any kind of change to that order, they can enter that under activities. And this activity is linked to the original order of protection. Now, while most of these sections are optional, this is an exception. I would estimate about 90% of our domestic violence programs do complete this order of protection, and that's one of the most common services they provide. So that is pretty complete. Okay, I'm going to move on to the offender section. I don't remember if I made any changes. If I leave some things empty, InfoNet is going to warn me. I'm just going to skip right over to the offender section and say, yes, it's okay to leave even though we haven't entered data. That's the extra data validation measures we have built into 2.0. So here is offender information. You can add as many offenders to a client's record as needed. Again, this is also an optional section, but most providers complete the offender demographics, about 90% in fact. In addition to offender demographics, you can enter if there are any visitation issues that is collected, and if this offender has a case in the criminal justice system, you can enter that information as well. Here we can see for this offender there was an arrest. The offender was arrested for aggravated domestic battery, a felony, the date of the charge. I'm going to open this so you can see a little bit more about how it's entered. And then if this case makes it to the prosecutor level, you can indicate if there were charges filed at the state's attorney's level, if there was a change in the charge, and when all this happened. You can enter the outcome of this case and when it happened, and if there are any sentences this offender received as a result, that can be entered here as well. This really empowers providers to be able to advocate to their criminal justice partners and be able to say things like, of the clients we served, they had to go to court an average of 20 times over 6 months, or of the offenders that are linked to our clients, so many were arrested, but only 20% ever had charges filed at the prosecutor level. Okay, so the last area I'm going to demonstrate, well, I shouldn't say the last, almost the last, is some of the admin features in InfoNet that are available to providers, and they can click this little admin tool here. This is where they enter personnel. This is where they control those few fields that are defined locally. And what I'm going to show you in a little more detail is funding for staff utility. That's this is the tool providers use to make sure they're able to run reports and that their funders are able to run reports that are reflective of only what the dollars paid for. So this is what a funding for staff page looks like. The date issued here is always the most recent, but there are shifts made in funding and changes in personnel, of course. So I can see these are all past dates where there have been changes. So every time there is a shift in funding or how staff are funded, they add a new date here and they modify the funding information. So this is telling us we're looking at a staff person named Bob Barker. Bob Barker provides 4 types of services, and if I click on one of these arrows, it'll show me exactly how Bob is paid when he provides these services. So in other words, this tells us that whenever Bob Barker provides civil legal advocacy, the VOCA DV Services Grant pays for 50% of his time, and the VAWA Rural Grant pays for the other half. So this tells InfoNet how to run reports that reflect grant-specific information. And this is really critical to, most providers do have multiple funders. They can not only use this to track VOCA and VAWA or federal funds, but they can create their own locally funded sources like United Way, or maybe they're getting a grant from their county board. If those funders require grant-specific information, they can make sure that that is specified in their InfoNet. Okay, I'm going to go back to our PowerPoint, and I had some screenshots here as backup, so I didn't need those. So I am going to pause again for questions.
We see Susan's comment here, which is true. We weren't just thinking of VOCA. We were thinking, we had, as those user groups were formed together, they kind of said, here are all the different things we need. And actually, InfoNet continues to grow and expand. Data fields being changed or added based off of how providers have said their funding reports have changed as well. So we're kind of constantly have a running list of the changes to keep InfoNet relevant to the funding requirements that change.
Okay, how hard is it to work with grantees to define the staff funding sources? Good question. It does require a little bit of TA, and honestly, in providing technical assistance, a provider that needs help with setting up their funding for staff is usually a lengthier call than other types of questions we receive, so it does require a little bit of hands-on, but worth the effort. It allows us to track the impact of different funding streams, and with funders working together, we can help reduce redundancies and figure out where our funding is best with consideration to the other funders out there. And I hope I answered that correctly, or I'm interpreting the question correctly.
I think so.
Okay. Can you customize the funding source by year or funding priority? Maybe I'm not quite understanding.
Yeah, I'm wondering maybe if it's to know which funds in which year are paying for different sources. So from our angle, what we would know is that if VOCA is paying for a service in the year of the, let's say, federal fiscal year, that of the funding year pot, not necessarily when the grant cycle is, but which pot of money it came from? Yeah, I think that's the question about the pot of money. We would just know internally, working with the agency, that right now maybe we're pulling from VOCA 16, that is how all of our domestic violence agencies are being funded. We would just know that all services rendered in that year would be paid with VOCA 16.
Yeah, that is how we do it now, as Jacqueline just described. I mean, if we wanted to, we could actually add funding sources to InfoNet that don't just say VOCA, but VOCA and the fund year. We could do that, but we haven't seen the need to, but that is certainly possible. Mm-hmm.
So the next question, are programs that are using this also tracking the services they provide in internal databases, or does InfoNet replace the need for an internal database?
Good question. We hope it replaces the need for an internal database, but some of our providers do have internal databases in addition to using InfoNet. InfoNet does have one migration tool that can automatically import services from an internal database. We call it the data migration utility. About a handful of our providers use it. And it has to be, of course, they have to do work on their end to make sure that the records they're importing are compatible with InfoNet's requirements. But yeah, there is, I mean, we hope it replaces the need, but, some may want to have databases that have identifying information, which InfoNet will never contain that kind of thing, or case notes. So yeah, I think we might have missed the question too.
And no, it was a clarification to the earlier one.
Okay.
And with that, I would say sometimes even with a coalition right now, they just received a new funding source that has new reporting requirements that currently InfoNet cannot meet. So right now, their providers are needing to strategize about how they're using their InfoNet data to help meet those requirements and what else they need to track on the side. And then we have meetings with the coalition to say, okay, how could we build this into InfoNet? What's feasible? What's possible? And we're working on a solution together. But because reporting requirements change, there's some level of our ability to keep up with it while also maintaining the system is a bit of a both and. But we do our best, and ultimately we're always a phone call away to help grantees figure that out. But sometimes they do have to track things in internal databases, especially when they first receive a fund where InfoNet doesn't have everything that they need. But we're trying to move to continue to make it more relevant in that regard.
Okay. Okay. Moving on to reports. I'm now going to show you what kind of reports providers can run in InfoNet, as well as the way that funders and grantees electronically exchange data reports for their grants. A quick overview: standard is summary or aggregate data, the same type of data that funders have access to, and then all three of these, the three remaining report types, all produce record level data that are only accessible by providers, and they use them for case management, assessing data quality, and I will demonstrate each of these. Actually, I think I'm going to go back. We're doing pretty okay on time, so I am going to actually demonstrate these live again. Okay, so standard reports. If I'm a provider and I go to my reports menu, I'll see the different options that we just described: standard, management, exception, and ad hoc. This provides summary data. This is what I submit to funders. I just enter the date. There's some commonly used date ranges here. If I have a main center and then other offices in different locations or satellite offices, I can run report for just one of those locations or aggregate them together. And then if I expand this filters heading down here, I can run report with various types of filters: demographics, based on where the client lives, and here are some other filters that are available to local providers. Funders do not have access to these because it could get too close to threatening client confidentiality. So funders have to request this from the providers themselves if they want that. There's three types of standard reports. Your client information basically gives you all your intake information, and I had these pre-run. but it's hard for me to get with the.
You could reduce your screen on the right.
Okay, that's a good idea.
And then, yeah, now maybe just pull over.
Okay. Okay, so here's what a standard client information report looks like. I've got my total clients, new and ongoing. You're always going to get an unduplicated count here. All the basic demographics, and basically all the intake data that's entered into InfoNet. You will see here. So you want a client profile, this is the report you want to run. This is a standard service report. So you can see it breaks out all the service by type. It gives you the number of people who received each type of service. It also tells you the number of service contacts those people received and the number of hours. So this is really helpful for understanding intensity of service. Our old data reports with the authority before InfoNet, and for those not using InfoNet, this is before PMT, asked for a number of people served and the number of times. And if you don't have a case management system like this, that is very, very challenging to collect. Here is your shelter information, transitional housing, your community services, such as systems advocacy, training, prevention work, media and publications, hotline. Here's just a separate section for that isolate volunteer resources used. And then here are the FVPSA service outcomes. We see a lot of zeros because, again, this is the training site. So not much has been entered in the date I ran this for, which is last month. But those FVPSA outcomes are entered here into InfoNet. So those are standard reports. Those are 2 of the 3. I'm not going to be able to go through all of them. Management reports are what providers use to extract record level data. So here's what the interface looks like. It works the same at the top here where you can run it for any time period, select different locations if that applies, and there's various management reports available, and each one has its own set of options. This one allows me to click different data elements as columns. I can sort by geographic data, and then I have these filters. Each one's a little different. If I click on this one, the options change up a little bit. So I'll show you 2 management reports that our providers probably most commonly use. This is a client detail information report. So you can see I have client level detail, and I can see all the services these people have received as well. So this person has several service contacts, including shelter stays, so I have multiple rows, and it gives me a bird's eye view of the different clients I have served with, whatever pieces of information I want to include in my management report. And then the second example I'll show you is one of my favorites. This is called the Order Protection Management Report, and it's the only InfoNet report that allows you to run for future dates. So you can see here, I ran this report for today through the end of March, and one of the options is you can choose whether to run this order protection report by the issue date or the expiration date. In this case, I ran it by the expiration date. And now I have a list of, I have these 2 clients here that have orders of protection that are due to expire soon. So that's going to really help me keep track of who I might want to follow up with. I can call these people and say, hey, do you realize your order of protection is expiring soon? Do you feel safe? Would you like to get it extended? And then the last type of, well, actually, not the last. It was the last for a long time, but with 2.0, we added a 4th type of report. But I'll move on to exception reports. And exception reports are primarily to improve data quality. Providers are instructed they need to run each of these exception reports at least once a quarter, and it helps them flag or identify red flag entries. So the example I have to show you of an exception report is this one. open and lengthy shelter dates. You can see when I click that exception report, it asks me for the number of days, and I changed this to 120 days. And when I generate that report, it gives me a list of all the client IDs who have a shelter stay of 120 days or more. And what this does is help me keep on top of updating my client records. So I can look at this, these clients are still in shelter. I mean, this person's been in shelter since April of 2004. My goodness, somebody needs to enter an end date for that person.
So this might be where then providers go back to their data files, their physical files, and can go back and update the shelter end date by referring to the client's physical file. Because usually that's where this information is tracked, and maybe it just didn't make it into InfoNet, which happens sometimes.
Correct. Okay, so the last type of report I'm going to show you, which is a new feature of InfoNet 2.0, it's called the ad hoc tool. It's very robust. But in a nutshell, this tool allows providers to be able to pull out any kind of, if it's entered into InfoNet, they can pull it out in different formats, sorting orders and filters. Admittedly, it should be a person who's comfortable with data and data savvy, but we have found in our communications with providers, every provider has one data nerd. At least one, and that's the person.
Maybe it's you on this call, or like you can resonate with that, being a data nerd.
So this allows them to choose all the different data tables that make up InfoNet structure, and they can select anything they want to pull out in their report. Down here are filters that allow them to use different combinations of and or. And really just, create nested queries, those of you that may be familiar with this term. Once they create these queries, this allows them to save, so they can run them later if they want to save their report and just update it at later points in time. I created a report for this demo, so it's housing service days with residents. So I built this query, and I'm going to open it just to show you what I included. When I open it, it shows you all the fields I included in my query. Down here in the filter section, I wanted this report to include all people who were in shelter during the first 9 months of 2018. So this simply states, I want this for all clients who had a shelter begin date that was earlier than the last day of my period, and a begin date and a shelter end date that was equal or later to the earliest day of my period. Or their shelter end date is empty, meaning they are still in shelter. And when I run this report, this is what it gives me. I have a list of all the clients. It includes all the data elements that I wanted, and I am a happy camper. The last thing I will add about all our reports, or all InfoNet's reports, is they can all be generated in different formats, whether they're standard, management, exception, or ad hoc. There's a feature here that allows you to run it as an Excel file. That would be export raw data. If I click that, it opens up a little Excel file down here, and providers can save it as an Excel file. And then there's also a PDF option.
You're sharing your web browser so they can't see it.
Okay, if you can't see it, you'll just have to trust me. But
we can actually see that. Yeah, we
can.
Oh,
you can. Sorry.
Cool.
I assumed you didn't. And then there's also a PDF option, which makes it nice for printing and saving. And again, all of the reports have those options. Okay, so I'm going to stop sharing, and I'm going to describe the process that our funders and grantees use when exchanging data reports. So, and I'll show you also what the funders see when they log into InfoNet. So the funder logs in, they submit reports. And when they submit the reports, and you'll see how they do this in a moment, but they tell InfoNet to not run the reports for about 5 days. And that gives the grantees a heads up. InfoNet also has an automated email system, so once those reports are submitted, the grantees receive that email. It says, hey, this funder has submitted a report. It's going to run in 5 days, so you have to have your data entered by midnight. Then the reports generate. The grantees are notified again that these reports are done and they're ready for review. They go in and review that report. They can approve it, hopefully. If they see something hokey, they can reject it. And then usually there are a small number of grantees that reject the first round, so the funder submits the reports again for those that rejected. So logging in as a funder, this is what they will see. There's no data entry, so you only see a reports and an admin button up here. Here's my date range. Here is my run date, which again, I usually make later than just to give my grantees notice that these will run. Here is a list of all my grantees. I can check one or all of them. Here are my funding filters. And then I couldn't capture the whole screen in one shot, so this is the bottom section. And you can see these are the same standard reports that our local providers use. So the funders can run those same types of reports. And once those are done, now this is the grantee's view. When those reports are ready to be reviewed, the grantee logs in. They're notified that there's reports that need to be approved, so they can click on this link and approve or reject it. And then going back to the funder's vantage point, I can see here as a funder, okay, this provider approved their report. It's green and the date they approved it. This provider rejected their report, and if you reject a report, you have to type in an explanation. So this provider says, I found errors. They've already been corrected. Please rerun. And then this provider has not yet approved or rejected. That's what the yellow and the question mark mean. So that is the process. It's again, it establishes a central repository, making it easy to run a grantee report or a statewide report. It provides a good paperless exchange of these reports with checks and balances built in. The funder knows they're going to get unduplicated client counts, at least at the organizational level, without having to struggle and count how many were new for this funding cycle. It gives them more data than they had access to prior to the days of InfoNet service intensity, which I described. These data are also audible. When they do site visits, they can look at these reports. The provider can create management reports that match up to those standard reports. And further, that provider can go to the client's case file and demonstrate that, yes, this report shows 5 services were provided to this client, and here are records of those 5 services. Okay, another question break.
Bailey had asked, can users of InfoNet request or build additional reports as needed? So you saw the ad hoc reporting tool.
Yes.
They do use that. We're going to get into this next, but users also can request data, maybe themselves, they want to know about a particular region and compare their data to a region. Jen's going to give you an example of that, but they can also request data through us. That is one way they can do that. So the question, can confidential identifying information, address, date of birth, etc., be recorded in InfoNet and kept confidential to the program only?
We say no. Because InfoNet is internet-based, we don't want to allow any of that potentially identifying information. In our minds, if Target can get hacked, if the federal government can get hacked, there's always that possibility. So at this point in time, we are not close to ever allowing that type of information. You know, I mean, if things change, if technology gets ironclad secure, maybe we can talk again about that. But what providers do is they have their own file or system that links, you know, InfoNet's client 123V with that client's name and whatnot. You know, I don't know, maybe there could be some kind of like linking system where there could be something streamlined, but the identifying information is still not over the internet. But for now, the answer to that question is no. Okay, we are right on time, so that's good. My tendency is to take too long. Okay, so how are InfoNet data used? They're used in many ways. Local programs, of course, primarily they use it to meet reporting requirements. And now, you know, in the early days, that was probably the main incentive. Now that they're more comfortable with the system, I mean, I hear all kinds of different ways that providers are using it for strategic planning at the local level, and case management, program development. And authority staff, we do conduct regular trainings for directors and supervisors to show them how to use their InfoNet data for informed decision making. Jacqueline and I conducted one of those trainings last year and with domestic violence providers, and that was actually mandated by the two major state funders, Department of Human Services and ICJIA. They said, all the directors must come here for this training so that you can, you know, better learn how to use your InfoNet data for your own internal planning purposes. So they use it to look at client populations and how they change over time. We stress that no matter how much tenure you have with an organization, sometimes change can happen so slowly and gradually that you're not attuned to it until you see those numbers side by side. So it's important to look at that, and that enables them to be more attuned to and responsive to change. Clearly, they use the data to justify the ongoing need for funding, case management. One more specific example is they can and often do assess how impactful their outreach services have been. So an example I heard from one of our providers, they did a lot of, well, they were actually seeing an increase in the number of clients they were serving who were pregnant, and that prompted them to do more outreach with OB/GYN. In a similar fashion, you could, let's say you're a director and you allocate a good number of staff resources to train hospital and ER staff how to respond to and identify DV victims that they encounter. After those efforts, hopefully you're going to want to see an increase in client referrals that are coming from those organizations. And if you're not seeing that, then you know you want to think through what the next steps are. They also use it to identify service gaps similarly to how we do that at the authority with strategic planning. And we do remind them often that they can do a lot of the same things that we do here at the state level. And in a lot of ways, they can do it better because they're embedded in that community. They're more familiar with the different populations and the other resources that are in that community. Whereas at the state level, we don't have that same magnifying glass. So they could really be critical to helping identify service gaps and do strategic planning at the community levels. These are just a couple examples of what our providers have done with their InfoNet data. This one is showing that the number of clients aged 60 or older is increasing. And this is actually a trend we are seeing across Illinois. They still make up a small percent of the total client population, but they are slowly increasing. And this is going to prompt a director to say, hey, you know, maybe somebody in this age group is going to have a whole slew of different needs than somebody, a typical client in their 20s or 30s. So a director would decide to maybe send more staff to training on the needs of this age group. This next slide shows how they use their InfoNet data in conjunction with other sources of data, particularly census data, so they can see how their clients' demographics compare with the demographics of the community. And then how are InfoNet data used by funders? Well, obviously we use it for grant monitoring, program performance. If we target funds for specific purposes or populations, we want to, of course, ensure that the targeted population is, in fact, being served. We do a lot of trend analyses. We've got an article published on sexual violence trends. We're working on one right now for domestic violence. Strategic planning can be more continuous than how we used to do it prior to the days of InfoNet every 3 or 4 years. And we can more often monitor whether those funding priorities are in fact making a difference. Jacqueline actually did this very recently. We have our funding priorities that were established in early 2017, and she just recently gave a presentation to not only our board members, but our Victim Services Ad Hoc Committee, and looking at exactly how we're seeing changes in the data to see if our funding priorities are making a difference in the areas we prioritize. And our DV community, ICJIA, has worked with their providers in actually lobbying for legislative change. I'll give you a little more specifics on that example shortly. These are some articles and publications that we've completed using InfoNet, and these are available on our website. There are more InfoNet publications available on our website, but here is just a few of them. And here are some ways we've seen how InfoNet helps enhance victim services across the state. Having that more comprehensive picture, it allows us to target the limited funds more efficiently. You all know that you can always address a problem better when you know the nature and extent about it with more detail. State agencies and local providers now have access to a comprehensive set of reports that help identify population trends and service gaps. And this information is used to improve services in these areas, whether it's elderly victims or another area we've seen some growth in is clients coming in who have not been victims of intimate partner violence, but violence from their adult or young adult or teen children. So that's a whole different dynamic. This more streamlined system, it's allowed victim service staff to do what we are hoping they're spending more of their time doing, and that's serving crime victims and lessening the administrative burden. It's also really fostered collaboration between us and other state entities, public and private organizations, state, local. We now all work together a lot better, and those processes, again, are institutionalized, so that really helps us avoid duplication in efforts, and we share what we find with our planning efforts so that we're not being duplicative, and we're each putting our funding streams where they're most needed. And then probably what I have most enjoyed seeing during my tenure here is the fundamental shift in how providers perceive data collection and reporting. In the early days, it was seen as a necessary burden, right, in order to get grant funds, whereas now I've really seen how they're using it to improve their programs. The legislative example I referred to earlier, that was not long ago, only a year or two ago. There is a local ordinance that may be going on in other states, that in Illinois it was called the crime-free ordinance. It's between landlords and tenants, and it allowed landlords to evict tenants if police were having to respond to that unit too frequently. And this was unintentionally harming victims of domestic violence and putting in place a barrier that was preventing them, it's punishing them essentially for having to call the police. So we looked at InfoNet data and what type of housing domestic violence victims are living in. A large population are coming from rental units, so that data helped lobby for change in modifying this crime-free ordinance so that it doesn't punish domestic violence victims for calling police. Some research projects we've done, we did an evaluation of MDTs, both domestic violence MDTs and sexual assault some years ago, available on our website. Transitional housing, MDT, and the budget impact study. We had no budget in Illinois for about 2 years. And we have somebody now who is looking at InfoNet data to help see if what the impact of that was on services. And these 3 research projects were those that did require record level data. So we did have to get approval of the providers. And the providers are very much looked forward to those findings. The other 2, survivor trends and the plating process, used aggregate data, so we didn't need it there. And those are just a few. InfoNet 2.0, we deployed it last spring. The contract with our vendor actually only ended a couple months ago because we had a technical assistance period where we worked with them to make sure that we were able to support InfoNet 2 independently and weren't dependent on them. So some of the most important things we learned during this project were it's important to do your platform upgrades more frequently, and it's probably going to cost you a lot less money if you had done that. We looked into rebuilding InfoNet several years ago and had a little bit of sticker shock. When we saw what vendors were going to charge us for doing it, we ended up postponing it. And we weren't able to do it until OVC released their first Building State Technology Capacity Grant opportunity. So that certainly helped. But in the end, if we would have made it a higher priority and took care of those core foundational upgrades InfoNet needed earlier on, not only would we have probably spent less money, but we would have been able to take advantage of those technological advances that had occurred that could have really benefited our providers and ourselves. So that's probably the most important lesson we learned. Illinois' procurement process, particularly for technology services, is very cumbersome. I don't know if it's similar in other states. I would guess that it's, there is some process you need to go through before selecting a vendor that's going to complete a project of this level of importance. So it's so important to really understand that process, be ready to provide what your state requires and turn it around quickly, and build in time for that. Sometimes it can take longer than expected, and in order to make sure the process is fair and that a vendor is competitively selected, there's a lot of steps that have to take place in Illinois that will add extra time to your project. When you are selecting a vendor, a lot of, at least in Illinois, we were really encouraged at first to just go with the lowest bidder. And we had to really advocate strongly that we didn't just want to go with the lowest bidder because that could affect the quality of InfoNet for many years to come. So we were able to convince the state that vendors' proposed strategy for how they're going to rebuild InfoNet must be a factor in deciding who that is. So ultimately, we were able to make price only 25% of a total score in selecting the vendor. And being able to sit down and interview the vendors, that really helped too. Then you really get a sense of what their plan is and get to meet them, and you're not just looking at a proposal where they had their best writer complete that proposal. User stories, I'm not sure if this is a common term in the industry, but it's a document that runs through each page in InfoNet and exactly what needs to be entered, what the options are, data validations, And our vendor used these when rebuilding InfoNet, and I thought that was a really thorough way to make sure that they were meeting our business needs and that we had all the requirements in place that we needed. External testers, you have to have providers test your system. They're in the true business environment. You need to mimic that environment as closely as possible in testing. And then knowledge transfer. Admittedly, this was probably the weakest area of InfoNet 2.0. The vendor did a lot of good work, but they were based in Springfield, where we're up here in Chicago, and we had very frequent meetings, and they did come up here, and we went down there a couple times, but the knowledge transfer was a little weaker than we had hoped. So during our technical support period, our vendor, we had weekly web-based meetings where they walked us through the code and taught us how to make upgrades when they were necessary, because you never want to be dependent on a vendor if something goes wrong after your project ends. So for our next project, we are making sure that we are incorporating a very long technical assistance period and we're defining it more clearly. And then InfoNet stepping forward, our current endeavor, again made possible from the Building State Technology Capacity Funding opportunity that we just applied for this summer. We've got 3 major goals. For PMT, we can comply with PMT, but it takes a lot of manual calculations because InfoNet's reporting categories aren't quite exactly matching PMT, so there's a lot of translation that has to go on. Just one example, PMT has mutually exclusive race categories, whereas in InfoNet, it's a multi-select checkbox system, so converting those takes some work. So the goal for this is to have a button in InfoNet, providers enter the reporting period, they want a PMT report, and it does all that translation for them. We also need a similar tool for housing and urban development, or HUD. Our second goal is we want increased capacity to incorporate more outcome measures into InfoNet, and we're doing that by adding the capacity to add a lot of that intake data at multiple points in time. And we've got groups going on now with providers where we're thinking through other possible outcomes for improved safety and well-being. And then the most exciting goal stepping forward is we're building a whole new interface for police and prosecutor-based programs. So we have another group working through requirements for that. So overall, this is what has helped us over the years. Partnerships, I can't underestimate the importance of that. That includes other funders and users. We think that formally established trust between those partners is important. Diversify your funding sources. That pending agreement we have with the State of Chicago and DHS are critical for keeping consistency as well as sustainability. It allows us to help make InfoNet changes as needs change and evolve over time. We use that data. We model that we use it for providers so they have ways they can use it. And I can't underestimate the importance of making sure that system is useful to providers, not only for grant reporting, and you need to provide training to make sure they know how to do that. So these are some next goals and possibly some dreams that we're always going to aim for. The source code for InfoNet 2.0 will be available soon. We are still squashing a couple annoying bugs, and as soon as we're done doing that, we will send it to OVC where any of you can access it. We would love to find new state partners. When you share resources, you maximize them and have more minds at the table coming up with great ideas for how to make things better. So if you're interested, please feel free to reach out to us. We absolutely want to continue using it to publish relevant research and informing our strategic planning. If any of you are looking to build a similar system, whether it's using InfoNet source code or some other means, please consider us as even in an advisory role, maybe a more formal partner. And we could possibly, now that we have InfoNet 2.0 deployed and we're ready to be sustainable for the next several years to come, we could possibly host InfoNet for other states interested in using it. And a dream that we're always going to keep in our mind is, wonder if one day InfoNet could be a national system and then maybe some federal organization could take it over and we would all be standardized. We think that would be really cool. So that concludes our slides. So this is our contact information. We'll take some more questions.
And I'll just pop in as people write in their questions. Like Jen said, we are super open to sharing our lessons learned and also really open to the discussion of what it would look like if your state may not have the capacity to take this on their own. We would love to talk about what does it look like for us to enter into a partnership where we can host it on behalf of other states and provide that technical support that's so key that we know is crucial for the success of InfoNet. And we already have all of the safety and security in place, which is another huge aspect to bring on.
Okay.
So real quickly here, before you guys get into next questions, I'm going to go ahead and launch our evaluation poll. Please continue to enter in questions into the chat, but I'm going to go ahead and launch the poll to give you all time to fill it out. So please continue to answer questions. I'm going to open the poll now and bring it back to Jennifer and Jacqueline.
So I know, Bailey, you asked about our trainings.
Are they regular?
So you can speak to that maybe, Jen.
Yeah. We honestly have neglected training somewhat in the building of 2.0 because we had to focus so much on that. We did conduct a training for everybody last year, and now that we are, on a much more solid technology platform, we want to pick that up again and make them more regular because we recognize that is really important, enabling our local providers to be able to do this kind of work.
And we have some pre-recorded webinars also that Jen has done, especially when we rolled out 2.0, about kind of what was new and different for providers. I'll also mention we're in the process of updating all of our manuals, so those also go along to help agencies with at least the day-to-day of InfoNet. And then even in our trainings about how to just basically enter data into InfoNet, we always, as researchers, try to bring in a frame of some level of research basics or even how to compare data with other sources. In trainings I've been in with Jen, she's so great about making sure that people are aware of the other information they could use to help advocate for better responses or even to understand how even census data can be super informative for them to look at the impact that their services are having or even who may be missed in the process. Are there any other questions? We don't see any in the chat box.
So while we're waiting for other questions, I did quickly want to mention that, the reason why Susan Howley, the project director, and I made a point to do personal emails to all the SAC directors and VOCA administrators to let them know about this webinar, is to let you know about the possibility and the great opportunity here. And, even with Jennifer and Jacqueline mentioning that they could be a partner, they could host for you, this is a great opportunity for SACs and VOCA to really work together on something like this. And, I hope that this webinar has made you realize that this is a feasible thing that could be done in your state. And, I know in our survey that we gave, over half of you had mentioned that your state had at least been considering having a statewide system like this. So, I hope this has been really valuable for everyone.
anything else you can think of, Jen, that about InfoNet we haven't talked about?
No, it's just, you know, when these advisory groups were meeting back in those days, I was an intern, and I remember hearing about all the buzz and excitement about InfoNet. I think I sat in on a couple of those meetings, and you know, it's just such a privilege to be sitting here over 2 decades later, showing other states what it's like today. Just really, really cool. So I hope some of you might be willing to have a conversation with us about how you might want to implement something similar.
So I'm not seeing any more questions flow in. If anybody does think of a question, feel free to enter it. Please fill out the poll if you haven't had a chance to do so yet. You know, I know questions might come up after the webinar, so please, you know, feel free to reach out to me or Jennifer or Jacqueline. You know, I think this has been a really great discussion and so much great information, and I really thank both of you so much for doing this webinar for us. And you know, doing it, we intentionally did it at the start of proposal season here because we do expect that technology grant will be released again, and you know, that could be a great starting point for another state that's looking to fund something like this. So I wanted to quickly remind everyone to please follow the Center for Victim Research on our social media. If you have trouble with the library or need help with searches, please email our librarian. Please let me know if you need help with your login to the library. We really want to make sure everyone has access to that and has assistance with using it. We also do podcasts, so in addition to the ones displayed here, please follow us on SoundCloud, Spotify, and Apple Podcasts as well. So again, thank you very much. Thank you, Jennifer and Jacqueline, so much. And
Thanks
everyone
for having us.
Of course. Thank you so much. And so everyone have a great evening.
As well.